Hey, welcome to another video from SkinnyMedic. I want to do a quick review for you on the Halo chest seals, and while I've got you here on the video, I'm going to show you when and how to use a chest seal. So thanks to my UTM simunition round, we now have a penetrating trauma to the chest. So we're going to fix that by putting a chest seal on it. In this demonstration, we are going to use the Halo chest seals. Now they have a tear here, we can tear across, open them up, and this is a resealable package. And actually you can use this packaging for a chest seal if you needed to. We could tape it up using some good quality tape and tape it up. So we're going to use it though to take care of my little buddy with a gunshot wound. So as you can see right here, we do have a gunshot wound to the chest area. Now we want to use a chest seal of some sort. Now in this demonstration we're going to use the Halo chest seal, but a good chest seal is good for the neck all the way down to the stomach. We don't put a tourniquet on it, we don't wound pack this area, we just put a chest seal on it and we seal it up. So we have a gunshot wound right here that we need to take care of. So we're going to have gloves on. You can wipe away any kind of blood, anything like that if you'd like to, with a 4x4 shirt, clothing, whatever you need to, just want to wipe the area clean. So open up. Also we can open up from either end on this packaging. And you get two chest seals, and these are non-vented chest seals. No big deal, we can take care of that in just a few minutes, I'll show you that. But we can apply these. These are super sticky, so they're going to peel off. Pull the pull tab, and then we just apply it. And now we have that sealed. So this is sealed. So this is now going to hopefully allow air to come up and down the trachea, up and down the throat where it's supposed to. Now because this was a gunshot wound, we do need to log roll the patient and see if there was a gunshot wound to the back side. So I'll log roll him up here. And let's say there was a gunshot wound right here. We have an exit wound. So then we can apply this and then roll him back over. Now my buddy here that I shot, that's kind of questionable, but hey, whatever. If he is awake and having trouble breathing, there's absolutely nothing wrong with sitting him up and letting him breathe on his own easier by sitting up, right? Now if he's unconscious, things like that, you may want to keep him like this, and you may want to put him in the recovery position in case he vomits. This is your decision to make on the scenario. We can what if these things till the cows come home. But if he's awake and having trouble breathing, let him sit up. This is what we do when we're shoulder breath. We sit up, lean forward, things like that to get more capacity into our lungs. So we can let him ride like this, or we can even put him in the recovery position in case he vomits. We can clear his airway. So I will say that if you think your patient has a spinal cord injury, meaning they can't move their legs, arms, or they're having numbness and tingling, things like that in their extremities, then we would not want to sit them up. We have to maintain C-spine, and there's some precautions we have to take there. But for the most part, penetrating trauma, you're going to be able to move them, sit them up, things like that. So like I was saying before, this is going to be a non-vented chest seal. It means that when air and blood are building up inside the chest cavity, they have nowhere to go. Typically, you don't see bright red blood just squirting out of the chest or the abdomen, anything like that, because all the major arteries are on the inside. They're buried deep inside here. So you can't see them in the neck. Of course, then you'd want to control bleeding, things like that. So you have a patient here that had penetrating trauma, they got a sucking chest wound, and now they're starting to go downhill. It means they're starting to get more shorter breath, maybe the O2 saturation is dropping, they're not getting as good chest rise over here. If you listen to a stethoscope, you've got decreased breath sounds, meaning you don't have as good breath sounds over here as you do over here. Their heart rate's fast, their respiratory rate's up, and they were doing fine a few minutes ago. So that means we probably need to look at venting the chest seal. So we can pull this back, and we can let the air come out, blood come out, things like that. Now, when they take a deep breath, it's going to change the pressure, and when they breathe out, things like that, it's going to change the pressure inside the chest cavity, and that's what's going to allow the blood and air to rush out of here. So let your patient take a few deep breaths. That's going to hopefully change the pressure and will allow that air to come out, blood to come out, and then you can seal it back up. Now, as you can see, my patient doesn't have any chest hair, things like that. He hasn't went through puberty yet. But if you have a patient who has chest hair, this is still going to stick. You can see how super sticky this is off pulling off this skin. So if your patient does have really thick chest hair, then you may just have to bear down a little bit harder to get a good seal. But this is still going to typically seal on a patient even who has a furry chest. So it's just to kind of do a quick recap for you on when and how to put a chest seal on. So we talked about when. You have penetrating trauma, means you have a hole in the chest, abdomen area, even up to the neck. Now the neck, you do have some major arteries running right through here that we have to control bleeding if those get hit. But as far as a hole, you want to seal from here all the way to here. We don't wound pack that. We don't put a tourniquet, things like that. We want to seal it up. So we're using the Halo chest seals here to accomplish that part of it today. So seal it up, whole. Remember to check the backside. You'd be amazed how many first responders, EMTs, paramedics forget to check the backside for their patient. So log roll, you may have some entry wounds there, may have some exit wounds, you may have another stab wound back there, whatever. So double check the backside and make sure. So that's the win. You have a hole in the chest, you seal it up. We talked about how. We use the Halo chest here. There's other chest seals on the market. You can even improvise. We talked about using the packaging as part of a chest seal. So you can improvise some things there as well. But the main thing is we want to seal this up. So if you're looking to purchase the Halo chest seals, you can go to our website, shop.skinnymedic.com. Get them from us. That helps support the channel, helps support what we're doing here. So we appreciate it. So thank you guys for watching. You never know when you'll be the first responder. We're in the right gear and the right training. Also, if you're interested in my shirt, we're going through Teespring for our t-shirts now, so you can pick any color, the size that you want. So if you like the t-shirt, I'll put a link down below to go to Teespring as well for those. And while I've got you on the video, I'm going to show you when, how, and so if your patient has chest hair, really thick. So if you're looking to purchase the Halo chest seal, you can go to my website, shop.skinnymedic.com. So if you're looking to purchase the Halo chest seals, you can go to shop. Good night.